Friends, welcome to Time with Thebsian. Today's episode is on ultrasound technology in medicine. That means for what kind of diagnostic purposes ultrasound technology is used in medicine. In the Time with Thebsian program, which is on medical devices, I have introduced an equipment which is being used for diagnostic purposes in medicine. I have mentioned in earlier videos, machines are also included under medical devices by the Drug Controller of India. So it will be ideal to talk to you on some medical equipments which come under medical devices in my program on medical devices. Ultrasound machines I selected because that is the most commonly used equipment in the diagnostic medicine. Ultrasound medical device comes under the medical device law and has to undergo all kinds of tests which is necessary to pass a medical device for registration. As long as ultrasound machines are considered, no federal radiation safety laws are not binding to this machine because they are medical devices. Because they are medical devices, the laws regulating medical devices are followed by the ultrasound machine. Ultrasound technology was discovered some around 12 years before X-rays become into force, but they were used in the identification of submarines earlier, but their use in medical practice came very late, even maybe after World War I. The use of ultrasound in medicine started with their use in obstetrics and gynecology, identifying medical problems in the abdomen. Later it was extended to thorax, and subsequently ultrasound became frequently used in many parts of the body or to identify deficiencies of many organs in human body. Roughly we can say it was ultrasound found use in cardiology, urology, orthopedics, and in almost all organs in the body. Ultrasound produced by the machine hits on the various parts of the organ, and the sound is reflected, which is received by the machine and analyzed by a computer to form differential pictures about the organ. And the computer analyzes the differential picture and analyzes the differential images and prints out the summary of observation by the artificial intelligence, which is read by the pediatrician or the physician who orders the ultrasound. Ultrasound is an equipment which works by using a machine which produces ultrasound, and along with the transducer which is placed on the body or portion of the body which is to be scanned. Ultrasound, I mentioned that the machine is there and the transducer is there, which is held by the sonographer or the technician who scans you with the sonography machine, holds in her or his hand, and a wax-like cream is put on the skin over the body portion which has to be scanned, and the transducer is passed over the skin in a scientific way so that different parts of the organs are scanned by the machine. And an expert sonographer can visualize the scanning image in the screen of the sonograph, even though the machine will analyze the pictures and give you a report finally. This ultrasound machine can scan various organs in the abdomen like liver, kidney, pancreas, urethra, then ovary, testes, everything. Almost all organs can be scanned. In the thorax, it can scan the blood vessels, lung, heart, and the lower portion of the respiratory organs. Sonography is usually or used mainly to scan soft tissues in the body, but recent techniques and improvement in the techniques helps sonographs to be made, or scanning could be made on bone structures too. Suppose we are doing an echocardiogram, the sound waves will pass through the vessels of the heart, different chambers of the heart, and they will be echoing through the muscles and valves. Valves are little more rigid structures, and the rebounding nature of the sonogram will be different from the muscle tissue or tubular vessels or that of valves. So a differential picture of the different echoes will give a clear picture for the physician to make a diagnosis about a healthy heart or a sick heart. Likewise, the gallstones or stones in the pancreas or kidney or urethra also could be localized and identified. There is lot of technology has been introduced in the making of transducers, design and fabrication of transducers, the water-like gel that is used to be spread on the skin of the body on which the transducers are passed also changed a very lot. The composition has changed a lot depending on technology, enhancing the picture nature, quality of picture of the sonogram. Latest techniques gives a kind of Doppler nature to the sonograms so that the flow of the blood can be followed using a ultrasound machine which is designed for the same purpose. And even now ultrasound is used during anesthesia, and also during invasive surgeries to help the surgeon to see the defects in the body very clearly and to assure that the whole diseased portion of the organ is removed successfully. And another important thing for the customers is that an ultrasound which is prescribed by the physician should be followed after taking only the consent of the patient, and there should be a consent form to be signed by the patient, and the doctor has to explain very clearly what is an ultrasound that is going to be carried out and what is the purpose of it and what are the pluses and minuses of carrying out an ultrasound. And there is a list of documentation that has to be kept in a ultrasound laboratory maintained by the technician and signed by the doctor and also the technician who is carrying out the ultrasound. And I was talking to you regarding the plus points of ultrasound machine, but there are things that can happen. The minus points about the machine, if the machine is not in good condition, it may give a wrong report. So the machine has to be serviced and kept in top condition by the hospital. And for this, the doctor is responsible to see that he uses a machine which is in good condition, not in a dilapidated condition. And dear friends, we have talked about the ultrasound machine, its function and its uses, and customer's point of view of consent for doing a ultrasound, and the records to be kept by the physician and the technician. Dear friends, thank you for watching this episode, Time with Thebsian on Medical Devices. I welcome you all for the next episodes and would like to remind you that there are English and Malayalam episodes that are aired on every Friday, and I request you to like and subscribe and share the video and take a special interest to see that you talk to your friends about the video so that as many people are becoming aware about medical devices Thank you very much.